I would now like to request Dr. GVS Murthy from the Indian Institute of Public Health, who is also our co-investigator, to please introduce the next speaker.
Good evening and good afternoon. It's a pleasure to introduce Professor Matthew Burton, who is the director of the International Center for Eye Health at the London School of Hygiene and Tropical Medicine. He also holds the Wellcome Trust Senior Research Fellowship and leads a large international research group of clinicians and scientists working to improve eye health in the low and middle income countries. Professor Burton has been the co-chair of the Lancet Global Health Commission, the commission which looks at harnessing lessons learned over the past 2 decades and presenting that evidence for the life-transforming impact of eye care. He actually has helped in getting the consortium together for the Commonwealth Eye Health Consortium, which was funded by the Queen Elizabeth Diamond Jubilee Trust, and which looked at supporting public health and research capacity development, subspecialty ophthalmology training, health system strengthening, and technology development for eye health professionals. Professor Matthew is an honorary consultant ophthalmologist in cornea and external eye diseases at the Moorfields Eye Hospital, London, where he specializes in the diagnosis and treatment of microbial keratitis. Professor Matthew is very well aware of the problems in low and middle income countries. He spent nearly 7 years of his life in Africa trying to look at improving the health systems in eye care in the African continent. He now also has a major fellowship from the Wellcome Trust, which looks at research on corneal infections in Uganda, Tanzania, and Nepal. It's a privilege to invite Professor Matthew Burton to present his talk. Professor Matthew.
Thank you, GV, for your kind invitation. It's a great honor to speak to you all at this first meeting of the IHOPE. GV's asked me to talk to you today about the Lancet Global Health Commission on Global Eye Health, Vision Beyond 2020. And I would just note that there are several people in this meeting participating in the audience who contributed a great deal to this work. This is a pivotal time for eye health. Last year was the culmination of the global initiative Vision 2020, the framework for the last 2 decades or so. In 2019, the WHO published the first World Report on Vision. In 2020, the World Health Assembly passed a resolution on vision, adopting the recommendations from the report. And in July of this year, the United Nations General Assembly passed a resolution, the first resolution ever on vision. I'd like to share with you some of the high-level findings from the Commission, which I hope will be useful in advancing and catalyzing action. And I think that there's quite a lot of intersection with some of the priority themes within IHOPE, such as economics and data, and looking at outcomes as well. The Commission explores eye health from several perspectives: the broad importance of eye health, the scale of the challenge, the economics of vision, the research needed, and finally, looking beyond 2020, delivering high quality eye care for all. It's the work of an interdisciplinary group of 73 academics, national program leaders, and practitioners from 25 countries. And in addition to the main report and its appendices, there are multiple subsidiary publications and case studies and other resources that you can access through the Commission website, and the link for that is at the bottom of this slide. So as I mentioned, the report is structured around 6 sections. At the outset, we wanted to agree as a group a combined definition for what we mean by eye health. And this is what we came up with. It's the state in which vision, ocular health, and functional ability are maximized, thereby contributing to overall health and well-being, social inclusion, and quality of life. And for our purposes, we were very keen that this definition was very inclusive in the way we were thinking and approaching this topic. The Commission examined the importance of eye health from several perspectives, including its impact on quality of life, general health, well-being, and mortality. Our starting point, however, was a detailed review of the relationships between improving eye health and advancing the Sustainable Development Goals, recognizing how the SDGs are really critical for many countries, if not nearly all, in the way that they approach development and decisions they're making at government and sub-government levels. And to explore this, what we did was a systematic review, looking for studies where eye health interventions were being implemented, and the investigators were examining outcomes which connected directly or indirectly to specific Sustainable Development Goal targets. Without going into too much detail, briefly, we found evidence that the provision of eye care services is associated with improvements in income and economic productivity, which of course helps to advance poverty reduction, multiple intersections with general health and well-being, not surprisingly, significant relationship between improved vision and improved educational outcomes for kids in school, and multiple examples for reducing inequalities. And what we identified were multiple direct, but also some indirect connections between improvements to eye health and positive impacts on targets related to different Sustainable Development Goals. So we would argue, in conclusion, that improving eye health and reducing vision impairment is an important, if not an essential, enabler to advancing the SDG agenda. And I think this is really reflected in the recent UN resolution. If you look at the resolution wording, they really pick up on the importance of improving eye health to multiple SDGs. We did a series of analyses in which we mapped the complex connections between eye health and general health. And this diagram, which is from the Commission, although it appears a bit like a plate of spaghetti, seeks to try to summarize specific connections. Impaired eye health has widespread direct and indirect impact. For example, it can contribute to exacerbation of depression and dementia. There's an increased cardiovascular risk, disease risk through reduced physical activity. And impaired vision is associated with increased risk of injuries. So here we can see that impaired eye health can broadly compromise health and well-being. But vision impairment and eye health are often perceived generally to have little effect on mortality. So as part of the work, the Commission conducted a systematic review and meta-analysis of the relationship between the different levels of vision impairment and the subsequent risk of mortality in cohort studies. And what we found was, with very convincing evidence, with increasing impairment of vision, there's an increasing associated risk of mortality. Worldwide, the scale of the challenge of vision impairment and eye health service need is really very substantial. New estimates have recently been published by the Vision Loss Expert Group in the Global Burden of Disease study for the year 2020, and these are summarized in the Commission. Worldwide, there are approximately 1.1 billion people living with vision impairment. And of these, 43 million are blind, 295 million have moderate or severe vision impairment, 258 million have mild vision impairment, so that would be below the driving standard in many countries. And a further 510 million have unaddressed near vision impairment. There are large interregional differences in the prevalence of vision impairment. This graph plots the 21 GBD world regions by age standardized prevalence of vision impairment. So this adjusts for differences in demography of different populations in different regions. And what you can see is the highest rate of around about 11% is the South Asian region, and it declines to around about 3% in North America. And to a certain extent, these differences are reflected in the absolute numbers of people living with vision impairment. Again, the region with the largest number, approximately about almost 170 million people living with vision impairment, is South Asia. And overall, globally, about 90% of people who are blind or have low, moderate or severe vision impairment are living in low middle-income countries. In every world region, women account for more blindness and more moderate and severe vision impairment than men. And what you can see in this figure is for each of those 21 regions, the excess number of women over men who are blind on the x-axis or who have moderate or severe vision impairment on the y-axis. Again, South Asia highlighted here has particularly large numbers in this figure. If we look forward now over the next 20 to 30 years, what we see is a relentless upward trend, such that by 2050, based on current trends, it's modeled that about 1.8 billion people will have vision impairment worldwide. In terms of causes in 2020, these graphs indicate for blindness on the left and moderate and severe vision impairment on the right, the principal causes of vision impairment. And for blindness, not surprisingly, cataract dominates 50% or thereabouts in the South Asian region. And again, I'm sure it will be of no surprise to you that for moderate and severe vision impairment, the largest proportion is attributable to uncorrected refractive error, again about 50% in the South Asian region. What these figures, which are really informed by vision surveys looking at visual acuity, are missing are a range of people with different eye problems that need services. So in the commission, what we did was we identified 3 distinct groups. One is people with manifest vision impairment who may already have had the benefit of services, say, for example, for refractive error, to correct their vision impairment, so require ongoing care. A second group are people with early stage disease who are at increased risk or higher risk of vision impairment later on in life. And a third group are people who have symptomatic conditions which may not be causing vision impairment and may indeed not cause vision impairment later in life, but require services. And these second and the third group are often forgotten about when we just focus in on the big population-based surveys and the GBD type data sets, which only really report vision impairment. The Commission's analysed several aspects of the economics of eye health. I'm really excited to see economics being a big priority within IHOPE. One of the first things we did was a systematic review of the eye health economic literature, and this really highlighted that for many world regions, there's very, very little data. We performed an economic productivity loss analysis for the year 2020 based on the latest data for blindness or moderate and severe vision impairment in the working age population. It drew in GDP per capita data, the relative reduction in employment by region, and the employment to population ratio. And what this came out with was a global annual economic productivity loss estimate of around about $411 billion with purchasing power parity. And South Asia here highlighted has the second highest regional economic productivity loss in terms of dollars at around about 60 billion. The good news is that for the large majority of people with vision impairment, obviously refractive error and cataract, we've just been looking at those numbers, there are cost-effective interventions. And part of the work of the Commission was to update some analyses around this. And what you can see here for the cataract cost effectiveness, that these highlighted studies, which are largely from South Asia, India, and Nepal particularly, show really excellent cost effectiveness in terms of the cost per daily averted or the quality gained in US dollars. And a similar picture for refractive error services. Far fewer studies in this area, and this one's quite old, but again, you see in South Asia, the lowest cost per day averted and or quality gained, which is really encouraging when it comes to beginning to address huge needs in the region. We're going to hear a bit more in this meeting about the economics of eye health. From the Commission's perspective, we identified a number of key actions or suggested future steps. An increase to use more standardized methodological approaches across different regions. There's a real need for more data from more diverse settings, particularly from low middle income countries where there's very little currently. There needs to be an improved understanding of the impact of vision on employment, and currently the literature around this, the primary data to base models on is really, really thin in places. In terms of research, we looked back at the last 20 years of eye health research, so the period of time that Vision 2020 has been in operation. And we did a sort of automated bibliometric analysis and identified around about 256,000 publications of primary data, so excluding reviews and case reports. And over those 2 decades, we saw an approximately 50% increase in the second decade compared to the first. So showing a really substantial increase in the numbers of peer-reviewed papers being produced. About 4% were clinical trials. And this map shows the regions of the world, or countries which are producing this data. And you can see India highlighted here, somewhere in the region, I don't know the exact number, I'm afraid, but somewhere between 5,000 and 10,000 publications, primary research papers during those 2 decades. So major contributions from India. As part of the work of the Commission, kind of looking forward, so that was looking back, looking forward, we convened something called the Grand Challenges in Global Eye Health, which was a 3-round Delphi exercise, which was open to people from all around the world, whatever their background, to contribute. And overall, I think around about 320 people contributed from over 120 countries. And they had the opportunity to suggest key challenges in their context, to look at the list that was curated and to vote on their priorities. And as a result of that, we've generated a global list and then regional lists of the key challenges. And these are the top 5 grand challenges identified by the panel. Firstly, the demand and access to refractive error services, an improvement in cataract surgery services, particularly around quality, equity and access, strengthened and better integrated child eye health services, the design of services to prioritize people who are being left behind, marginalized groups, and then the really big need in many regions to reduce the out-of-pocket costs for eye care, which can be an enormous barrier. A major part of the Commission's report is devoted to looking beyond 2020 into the coming decade and beyond, as to how we can go about as a worldwide community to deliver high quality eye care for all. It builds on the WHO's World Report on Vision, and the Commission urges countries to consider eye health as an essential part of universal health coverage. Indeed, we argue that UHC is not universal without affordable, high quality, equitable eye care. It needs to be included in national health policies, financing mechanisms, workforce planning, and healthcare delivery. We explored how health systems can operationalize integrated people-centered eye care, which is a core concept of the World Report on Vision. Integration of eye health services within multiple relevant components of the health service delivery and all levels of the health system is of key importance. There needs to be really coordinated intersectoral action, for example, with healthy aging initiatives, with school health programs, and in the workplace. The Commission provides multiple examples of how this is happening around the world. Another area we focused in on is the strengthening of the eye health workforce. This is clearly key to delivery of eye care. And one of the analyses was examination of the relationship between eye health workforce members, so ophthalmologists, optometrists, and others, and the age standardized prevalence of blindness and moderate and severe vision impairment. And in this figure, for example, you see the 21 GBD world regions plotted. Along the x-axis is the number of ophthalmologists per million people. And on the y-axis, the vertical axis, the age standardized prevalence of blindness. And what you can see is a general trend, a relationship with, not surprisingly, increased available staff to serve the population and lower levels of blindness. The report explores other issues as well as just purely numbers about aligning the workforce to the needs of the population, the development of enabling environments, the strengthening of training, and the sharing of different tasks. As we've heard already about big data and so on, technology and innovative approaches are going to be key for the future. In the Commission, we explore new approaches for a range of things, including development of mHealth solutions and the application of artificial intelligence. There's a lot of interest, a lot of excitement around the world in these. But I think what we all recognize, though, is that there needs to be really, really thoughtful application of these within a functioning public health system in order to maximize their impact and their potential impact. IHOPE, as I understand it, has a big focus on outcomes. And one of the things that the Commission did was to undertake a study, a review of different indicators, including a Delphi process with 72 experts from 39 countries with all world regions represented, looking at a whole panel of indicators and assessing them against the dimensions of universal health coverage in terms of access, quality, financial risk protection, and equity, to try and gather a global perspective on these indicators. And the report shows the top 7 identified by the panel, and there's a subsidiary paper that you can access on the website if you're interested in exploring a longer list. But a core indicator that WHO has been advocating for and has now been formally adopted and drawn into UHC monitoring is effective cataract social coverage. And alongside this is effective refractive error coverage. And this is a really important combination of not only the quality of outcome, but also the coverage, so an effective coverage indicator. And one of the things we did in the Commission was to kind of explore this further as a way of kind of assessing how we're doing today worldwide in progressing towards delivery of universal eye health coverage within UHC. So this figure plots effective cataract social coverage. Unfortunately, there's not a lot of data, and most of it's only from relatively recent surveys. And this plot at the top is effective cataract social coverage with the operable cataract level set at 660, which was up until very recently the WHO standard. So people included in the indicator calculation had vision of 660 or worse, and a good outcome was defined as 618 or better. Those benchmarks, targets have been changed very recently in the latest update from WHO to operable being worse than 612, and a good outcome is defined as 612 or better. So that's going to have a really big impact on where we stand today in terms of the effective cataract social coverage. So you can see in the top plot, that's the 7 world regions with the older definitions, which place the effective cataract social coverage in most world regions in the sort of 30 to 50% range. And as I say, the standards have been adjusted to 612 and 612. And what the effect of that is to reduce, dramatically reduce the current effective cataract social coverage. So this is data from Vietnam. And if you use the old definitions, basically the coverage is around about 40%. If you use the new definitions, it's somewhere in the region of about 15%. So this is going to provide a big challenge for countries to really step up to the mark and drive forward effective cataract social coverage over the next decade. I think the target is somewhere in the region of about a 30% increase. Linked to this, of course, is action to increase quality, and this is explored in detail in the Commission. Encourage you to have a look at that if you're particularly interested in cataract service delivery. And key actions are around governing for quality, redesigning services to maximize quality, transformation of the workforce and the working environment to promote quality, and really importantly, to promote or ignite demand in the population for quality services. A final area in the Commission I really wanted to highlight that we explored in quite some detail is equity and access to eye care. And just to highlight the challenge and the importance of disaggregating population-based data, is data from, this figure shows data from Nigeria. There's a very similar study from Sri Lanka, which explores the prevalence of blindness from cataract in population-based surveys in people over the age of 50, I think in this case. So this is data from Nigeria, and what you can see, it's been disaggregated into men and women, to those that are married and those that are not, and in this older age group, it was largely widows, and then into people who lived in urban regions and in rural areas. And what I want to sort of highlight here is that in this study from Nigeria, and the data from Sri Lanka is very, very similar, around 14%, 14% of this population were women who were mostly widowed and living in rural areas. But in terms of the proportion of blindness in the population they carried, it was substantially high. It was almost 50% at 48%. So 14% of the population, but 48% of the numbers of people affected who are blind from cataract. So this highlights the critical importance of understanding which groups are being left behind as we deliver services to ensure that they're designed to promote equity. The Commission has 10 key messages, which you can find in the summary. But our most important message can be found on the front cover. So zooming in on that, what we say is that investing in universal eye health is a realistic, cost-effective way of unlocking human potential by improving health and well-being, education, work, and the economy. And it is essential to achieving the Sustainable Development Goals. So we seek to reframe eye health not only as a health matter, but also as an enabling, cross-cutting issue within the SDG framework. And we believe that there is now really compelling evidence in favour of urgent global action on eye health. The Commission was supported by multiple organisations, and we're extremely grateful to them. And just to remind you, there's a website, globaleyehealthcommission.org, where you can access not only the report, but a range of other materials as well. Thank you very much for listening, and I hope the rest of the meeting is really successful.
Thank you, Professor Burton, for those insights.